Hi, my name's Alyssa. I'm a nurse practitioner. I'm going to be evaluating you today.
Hi.
Can you tell me your name and your birthday?
Kinsey Carson, 4292.
And what are you here for today?
A wellness visit.
All right, and what year is it?
2019.
Good, and can you tell me who the president is?
Donald Trump.
Good, so that indicates to me that she is awake, alert, and oriented. Next, we're going to go ahead and get a set of vital signs on you. Get your temperature under your tongue. Temperature is 98.3. Okay, check your pulse here. Pulse is 62. And respirations are 12. So all normal vital signs. Her height and weight was obtained in the lobby before coming in. Her height is 5'3" and her weight is 125. Blood pressure is 110/65. All normal vital signs. General appearance, she is a healthy appearing young female. Her appearance is appropriate for her age. No obvious deformities from what I can see. Next, we'll move on to the head assessment. Head is round and normocephalic. No obvious masses or deformities that I can see from the head. I'm gonna feel your head here. Tell me if I'm touching any areas that are tender. No. So no masses that I can feel. I'm just gonna check the scalp for any lesions. Scalp looks good. No lesions that I can see. Next, I'm gonna have you stick your tongue out. Good, and smile, and frown for me, and then close your eyes tightly. Good. So face is symmetrical, no facial droop. That would indicate that cranial nerve number 7 is intact. Next, I'm gonna take a look at your ears. Ears look symmetrical, no masses or drainage. Any tenderness to palpation here? Good. I'm gonna take a look in your ears. The tympanic membrane is pale gray, semi-transparent, no bulging or rupture, and no signs of an infection. All right, next I'm going to be doing a hearing test on you. I want you to tell me if you feel this, if you hear this louder in position 1 or position 2. Position 1, position 2.
1.
And again, 1.
1.
Good, and I'm gonna come around behind you. And I want you to tell me, do you hear this more on the left, the right, or equally in the middle?
Equally in the middle.
Good. So she has a normal Weber and Ryan test, which indicates cranial nerve number 8 is intact. Next, I'm just gonna assess your nose. Nose is midline, no obvious deformities. Any tenderness here?
No.
Good. I'm gonna take a look up your nose. Good. No bleeding or drainage or polyps that I can note. Next, I'll have you close your eyes for me. And I want you to tell me what you smell.
Alcohol.
Good. So she was able to appropriately identify the smell, which indicates cranial nerve number 1 is intact. And then I'm just gonna press on your sinuses here. Any tenderness with that?
No.
Okay, so no tenderness with palpation on the sinuses. Next, I'm going to take a look in your mouth. Any pain in your teeth at all?
No.
Good. Okay, you can just open your mouth real wide for me. The buccal tissue all looks pink, moist, no lesions, hard palate is intact, normal dentition, no dental caries, and no missing teeth. Now can I have you stick your tongue straight out for me and say ah? Alright, soft palate and her uvula rise with that, which shows that cranial nerves 9, 10, and 12 are all intact. Her eyes are symmetrical, no ptosis that I can note. We're going to check your pupils. So I'll just have you look straight ahead. Good. Pupils are both round, brisk, and reactive to light. Next, I'm going to take a look inside your eyes. If you can just look straight at me, or straight ahead, I'm sorry. So the optic disc is sharp and red reflex is intact. Next, I'm going to step 6 feet away from you, and I'll have you cover your left eye and go ahead and read the bottom line for me.
LTFPH.
And go ahead and read with the right eye closed.
LTFPH.
And then open both eyes and read again for me.
LTFPH.
Good. So she has vision of 20/20, which is normal and indicates cranial nerve number 2 is intact. All right, next I want you to just look straight ahead. I want you to follow my finger with your eyes. Good, and then just follow my finger again. Good. So that is the 6 cardinal positions of gaze. She has no nystagmus with that, and eyes converge equally when taking my finger to her nose. That would indicate that cranial nerves 3, 4, and 6 are intact. All right, so next I'm gonna just take a look at your neck. Neck, from what I can tell, is symmetrical, no obvious masses. Any tenderness to palpation here?
No.
How about here?
No.
And anything down here?
No.
Good. Okay, so lymph nodes are non-tender and they are non-swollen as well. Any tenderness here? No. Good. Okay. Now I'm going to come behind you and feel your thyroid. And then I want you to go ahead and swallow for me. Good. Thyroid is normal shape, no masses, and it moves freely with swallowing. Next, I'm going to have you go ahead and shrug your shoulders up. Good. And turn your head against my hand. Good. And again. Good. Okay, so that is equal bilaterally. Shoulder shrug is normal, and that would indicate cranial nerve number 11 is intact. I'll have you bring your arms out for me. Just going to take a look at the skin on your upper extremities. A couple moles, but no obvious abnormalities. Skin is pink, warm, and dry, and no tenting. And nail beds are without cyanosis or clubbing, and she has brisk capillary refill. Good. I'm just going to feel your radial pulses. Radial pulses are +2 bilaterally. I'm going to have you close your eyes and hold your hands straight out for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, and that is without pronator drift And then I'm gonna have you bring your arms up like this and pull against me and push away. Good. So equal strengths bilaterally and no pronator drift. And then next I'm just gonna have you bring your arms out to the side and bring them up. Any pain with that at all? Good. So normal range of motion with the upper extremities. Next, I will be assessing your lung sounds and the symmetry of your chest. So I can just have you sit straight up for me. Chest looks symmetrical. No labored breathing, easy and regular, and no obvious deformities of the chest. I'm going to listen to your lung sounds now. Normally I would do this for 3 respirations at each site, but for the purpose of this, I'll just be listening to 1 respiration. So when you feel my stethoscope, just go ahead and take a deep breath in and out through your mouth. I'm going to come around behind you and do the same thing. Okay, and next, I want you to say 99 whenever you feel my hands touch your back.
99, 99, 99.
Good. So she has normal tactile fremitus and lung sounds are clear, no adventitious sounds noted. Next I'm going to be feeling your neck for your carotid pulses, and then I'll be listening to your heart sounds, okay? So pulses are palpable and regular rate. Also going to take a listen to the carotid arteries with my bell. So you can take a deep breath in and hold it for me. Good. And then same thing, deep breath in and hold it. Good. No bruits noted on auscultation of the carotid arteries. Okay. Next, I'm just going to take a listen to your heart. I would normally listen for 3 beats, but for the purpose of this, I won't. So this is aortic, pulmonic, tricuspid, mitral, and mitral mid-axillary. S1 and S2 is heard, no murmurs or gallops, and rate is regular. And then I'm going to feel for your PMI, so that is found at the mid-clavicular line at the 5th intercostal space. And the PMI is felt there. Next, I'm going to have you go ahead and lay down. And we will take a look at your abdomen. So I'm going to pull it down. So abdomen is non-distended, no scarring or obvious masses or deformities. I'm going to take a listen to your abdomen in all 4 quadrants. Normally would be for 2 to 5 minutes, but for this I'll just listen for a few seconds. Right upper quadrant. Left upper quadrant, left lower quadrant, and right lower quadrant. Good. Normal active bowel sounds are heard in all 4 quadrants. Next, I'm going to switch to my bell, and I'll be listening to the aortic and renal arteries. And no bruit heard on auscultation of the aortic and renal arteries. Next, I'm going to palpate for any tenderness or masses that you might have Just let me know if anything hurts. Any tenderness at all with that? Good. No tenderness or masses felt on palpation. Alright, you can go ahead and bring your gown down. And next, take a look at the lower extremities. Skin is pink, warm, and dry, no edema noted, no varicosities, and no lesions or abrasions. And next, I'll feel your pedal and posterior tibialis pulses. Okay, those are all +2, equal in strength. I'm gonna have you push down for me. Good, and pull back. Good. And then just check the cap refill. Toes are pink, warm, and dry. Cap refill is brisk. Next, I'm gonna have you, if you can bring your right leg out to the side. Good, and back in, and left leg. Good, back in, and then bend up your right knee. Okay, and then your left knee. Any pain with that at all?
No.
All right, so normal range of motion in the lower extremities. Pulses are equal in strength, and as well as dorsiplantar flexion is equal. All right, I'll go ahead and have you sit back up for me. Okay. Next, we are going to do some sensory assessment. I want you to keep your eyes closed. When you feel me touch you with this soft cotton ball or Q-tip, just let me know and say now, okay?
Now. 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 Now.
Good. All right, and then next I'm gonna test, and I want you to tell me if what you feel is sharp or dull. So this will be the dull, this will be the sharp, okay?
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Good. So she was able to accurately tell me whether it was sharp or dull, so that indicates that cranial nerve number 5 is intact. Next, we're going to test some reflexes on you, okay? So I'll have you just rest both of these arms down. We're going to do the brachioradialis. Good. And then go ahead and have you flex and relax. Okay. And then flex again and relax. Okay. And then we're going to do the triceps, so just go ahead and hang your arms heavy for me. Good. Just hang it heavy. Okay. And then we'll do the patellar reflex. And then the Achilles. Good. So all reflexes are intact. Next, I'm going to have you, I give you 3 words, and I want you to try to remember them for me, okay? So the 3 words are apple, watch, and penny. And now I'm gonna have you draw a picture of a clock for me. Good. All right. So that is an accurate picture of a clock. And then can you go ahead and recall the 3 words that I said?
Apple, watch, penny.
Good. So she was able to recall the 3 words and accurately draw a picture of a clock. So that is a positive mini cognitive test. She passed that. Next, I'm gonna have you stand up for me, and I'll just have you walk across the room. Good, and then when you come back, I want you to walk heel to toe. Good, and then just stand there, and I'll have you close your eyes, and we'll count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Next, I'm gonna have you take your heel and drag it down your shin, and then same with the other foot. Good. And then please close your eyes. And I want you to hold your hands out, and then bring your both hands back and forth to your nose. Good. Okay, and go ahead and open your eyes. And you can bring your arms down. Now I want you to go finger, nose to finger, okay? Good. And then with the other hand. Good. All right, you can have a seat. So gait was all normal, no ataxia. She was able to perform all my tasks appropriately. This patient is healthy, young female, no abnormalities found on her assessment. My recommendation for her would be continue to see me yearly for her yearly exams, and then if anything acute comes up, go ahead and make an appointment with me. Make sure you're following up and staying up to date on all your vaccinations. And is there any questions that I can answer for you today?
No.
Okay, thank you.
Thank you.